There's a wonderful question here, which I'm going to address to both Peter and David. I saw an article today shared by a mental health organisation that said more research needs to be done and we're jumping the gun by scheduling MDMA and psilocybin as medicines. Why do you think there are still some psychiatrists and researchers who have this view when there is so much evidence to suggest these substances help our mental health?
My view is that psychiatrists have been de-skilled. Psychiatrists have ceased to understand the nature of evidence. And it's not just psychiatrists. I think most doctors are now rely on regulators to tell them what works and what's not. And regulators have got stuck in a model which was generated in the 1950s of RCTs. RCTs in this field cost millions of, maybe billions of dollars sometimes, if depending on the drug, are rarely done. And when they are done, they're so expensive that the costs of the medicine then become prohibitive to in most countries. So what we're going to do is a different model. This is a model, and Peter touched on this, of generating real world evidence. The drug science statistical team, we're writing a paper on this. We think we can, using a registry and using what's called Bayesian analysis on an individual patient, generate within a year of this initiative more data than will be collected by any of the RCTs that are going on at present. It'll be more useful data because every patient's data will count towards the outcome. If you do an RCT, look at that Compass trial. 60% of the people didn't actually have a useful treatment. Their data is almost useless. It doesn't help doctors decide whether psilocybin works. What we're going to do with the registry is everyone is going to get an effective dose, and then we'll know exactly how useful that dose is. So we're not only going to be helping people in the register, but we're also going to be collecting data. And we've done this. We've already done this with medical cannabis, with the drug science registry, where we put 3,500 people through now and come up with remarkable insights, not just in the main disorders, but also to address the question that the previous speaker raised, of comorbid disorders. We know that the patients with resistant depression and resistant PTSD, the majority of them will have comorbid disorders, so they will be excluded from RCTs. And yet they're the patients that need the most help. And the registry approach we're taking will generate evidence of psilocybin helping those comorbid disorders as well as the main disorder.
Yeah, David, I might just add my views, because I do find it's sort of extraordinary and frankly a bit disappointing that we hear comments like that. I think some of those comments come from researchers who are invested in the space, and they think that somehow what this means is that their research is devalued. Now, I don't subscribe to that. I think their research is still incredibly important, but as David said, the beauty of this is now we're going to have real world evidence to sit alongside the clinical trial evidence. And with the real world evidence, you're going to have people presenting with comorbidities, which, as David said, is difficult with a clinical trial. And that means that, patients have a real chance of getting the benefits of these therapies rather than hoping they can get into a trial and then finding that they get rejected. So, for those people who are negative, I would just say to them, look, reach out to us. We'd love to debate this with you. We know that you're keen to see more people get well and out of the mental health system. We are as well. So let's start working together. And if you're concerned about having the right controls in place, then sit down with us and we'll brainstorm it. And, obviously bring David in and get his views. But together we can actually produce a system that I think meets really high standards and can lead the world. So for those naysayers, please come aboard, and rather than being negative, debate with us the way to make this as powerful as possible so that more people get out of the mental health sector and get well.